broad bipartisan agreement regarding the dangers of a healthcare system that prioritizes profits over people. We cannot lose sight of the big picture. Caring for the sick and providing life-saving medications should not be a cash cow opportunity. It is staggering that last year alone, pharma spent $8.1 billion on advertising, while millions of Americans still can't afford their medications. This kind of behavior by big pharma and pharmacy benefit managers, or PBMs, squeezes those in greatest need who have the fewest resources. So, Dr. Dunn, I appreciated hearing your testimony about your work as an independent pharmacist. Could you tell us why it is important patients have access to a local pharmacy they trust?
Yes, thank you. So people need to be able to go to a pharmacy that they know will be able to take care of their complex medication regimens. And I think that the average person sees their pharmacist a lot more than they see their doctor. So I think that it's very important that they have a variety of choice, because someone needs to, just like any other healthcare practitioner, have a level of trust and confidence in that person that they're receiving care from.
Thank you so much for that. And I want to circle back, as stated by my colleague, Rep. Bush, according to one of the studies in 2019, 1 in 8 pharmacies closed between 2009 and 2015. This is deeply unfortunate, especially for those who rely on their neighborhood pharmacies for more than just their prescription pickup. Now, we heard from Dr. Dwayne when he responded to Ms. Bush's question, but I want to ask you, Mr. Asasi, if you could elaborate a little bit more on how the closure of an independent or community pharmacy limits healthcare access for a patient living in a low-income urban setting.
You bet. So important to say that pharmacists can play a critical role in the ability of people to get high-quality health care. There's wonderful examples across this country. North Carolina Community Cares comes to mind, where they help patients who are coming out of really complex inpatient procedures, and pharmacists played a key role in continuity of care and making sure they were okay. When you move people to mail-order pharmacies, you move people out of community-based settings, you lose all of that context. And for folks who are in underserved communities, they already have much less access to doctors, nurses, et cetera. Pharmacists can be on the very front line and very effective. So it's a really concerning trend if we are creating financial incentives that are closing the access patients have to their pharmacists.
Thank you so much.